As of 2020, around 40% of adults in the US access their health records through a patient portal. This was up from 25% in 2014. Since digital options are becoming more available in the health industry, it's no surprise that there was an increase. These secure websites give people access to their personal health information from anywhere at any time. Users can log into their accounts to view their PHI such as lab results, immunizations, and appointment notes. Some portals have even more tools such as appointment scheduling, paying bills, and refilling prescriptions. But despite these convenient tools, most adults still aren't using these services. Hi everyone, I'm Matt from eTactics, and today I'm going to share surprising disadvantages of patient portals. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. The first major challenge with portals is getting patients to opt into using them. It's a disadvantage for both the provider and the patient when people decide not to use a patient portal. Patients miss out on the potential benefits available to them. Providers then need to spend more time going over information with the patient that they could have just accessed on the portal. But unfortunately, getting people to opt in is one of the biggest challenges for providers when it comes to these online tools. Even though a doctor may see the benefits, that doesn't mean their patients will. A 2017 report found that even though almost 90% of providers offered access to patient portals, only 30% of patients were actually using them. Part of this is because 57% of people believe they don't need them at all. Another big disadvantage is security concerns. 22% of people don't use a patient portal because they're worried about the security of their PHI. The more online accounts someone has, the more susceptible they are to a cyber attack. Now this is especially true since people have a tendency to reuse each password up to 14 times, putting their login credentials at risk. In fact, 81% of hacks are due to poor password management. There's also a security risk with logging on to an account in a public or insecure network. Because of privacy concerns, providers need to take more steps to secure data within these portals. They also need to teach patients about the risks associated with their accounts and how they can protect their account from a breach. There's a learning curve with any new technology, so these portals could also cause confusion for patients. This may lead them to abandon using the portals, call the doctors with more questions, or they won't be taking advantage of all the site's available tools. Not only is there a risk of confusion with the tool itself, but patients may also get confused by the information in their health records. Almost half of adults in the US lack health literacy. The problem with patient portals is that people can misunderstand their medical notes and they won't have their doctor immediately available to explain what it means. This leads to concerned patients who then reach out to their doctor for explanations. In the end, the office may spend even more time answering calls and messages to explain what the health records actually mean. Another issue is that not all people have access to the internet or electronic devices to use the patient portal to begin with. People in low-income or rural areas have the most limitations. 25% of people don't use patient portals because they don't have access to the internet. This causes alienation and more health disparities among these groups since they don't even have the option to utilize these services. Finally, there's more work for the provider. Because of each of the disadvantages I already explained, doctors need to put in more efforts for patient portals to be worth it. Since many people don't opt into the service, providers need to spend more time convincing patients to use them. They also need to implement security measures so that the systems don't get compromised. If patients don't understand how to use a tool or get confused by their medical records, a practice has to spend time teaching patients. And since not all people have access to these platforms, doctors need to find different ways to connect people with access to their health information so that they don't alienate anybody. Patient portals are meant to benefit clients. When people opt into using these services, they can use quick on-demand features to improve their health experience. But even with the ease of these sites, a majority of people don't use them. No matter what the reason is for not using them, patients lose out on the benefits that these tools offer. And providers need to put it in more effort for these sites to actually be worth it in the end. If you'd like to learn more about a patient portal that actually works, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.